What's up, good people? This is a very, very important discussion that I'm going to present right now. And I came across this on Medscape News, and it's a research based thing that I really want to bring forward here. And it's very important for all the parents. It's not just important for parents of those kids who have autism, it's important for every parent because autism is like an epidemic these days. So we all have to be cautious about it that our kids don't fall into that autism. An important thing in this paper that I am going to discuss today is about parents. So parents have a role in this. So parents need to be trained about their parenting because that can prevent or reduce or prevent the progression of autism. And autism is spreading a lot in the new generation. So be careful and be cautious about that. Because this study shows that if the parents are aware of their parenting, then there is an absolute risk reduction that you can do by a good parenting so that you can have an absolute risk reduction of autism. And so this paper says there is a strong evidence that training your parents, parents of your environment, of your culture, or your people, of your country, can, help guide the development of children with autism reaps consistent benefits, according to the systematic review and meta-analysis of more than 50 high quality studies. So that's important. So the point here is, and this professor of psychology is trying to make it, and he's trying to help people. He's a professor of psychology, Mr. Timothy B. Smith, and he says that we have to make referrals. We have to have referrals for the parent training, and we have to make sure that they get trained so that they can, prevent their kids from progressing into the worst form of autism. Or if you catch autism earlier, you have to be able to, train the parents, because parents are the ones who are under direct, interaction with their kids, and they can do the best job with the best patience towards their own kids. So, and this program shows that parent that the program of this kind will show the parents that how to teach the functional skills and address the maladaptive behaviors. And that's the key. The maladaptive behaviors are the ones that are key thing that we target in this kind of training for the parents, so that the kids can be better performers in their different phases of their life. And so it's a parent implemented intervention. It's not about teacher or daycare center or anything like that. It's about the parenting. Parenting. That's the thing that makes the difference. That's the thing that's going to help. And it's not a small study. They studied close to 3,000 children. So it's a huge randomized clinical trial, and it's based on 54 studies. So, and what they found out that parenting, the parent training, has a strong impact, moderately strong impact on the benefits from the parent mediated interventions. So there goes the benefit, and you have to hit the positive behaviors that you are trying to target for those kids, and their social skills, that how they interact with the parents, how they interact with the people around, how they interact with the surroundings, like watching TV. And it also depends on the following of the language and the communication and the maladaptive behaviors and the life skills. So all of those things are gonna be tackled in this kind of training of the parents. So we need to support this kind of behavior, this kind of referral, and come up with the benefits, and that's gonna help your kids grow into the best citizens. They become doctors or engineers rather than becoming handicapped kids, So that's the purpose here. And this thing goes regardless of the child age or the sex. That's the benefit. So earlier you catch, earlier you tackle, the better. But even if it is late, it's never too late. Even if it's a boy or a girl or whatever the gender is ascribed at the time, you know, it doesn't matter. So these things are important and you can have an impact. The biggest intervention is referral, referral, referral. Referral is very important in this. And it was noted that primary care physicians are really good trained, better than ever, to identify the autistic spectrum disorder, ASD. And that's the thing. First thing is identification. Once you have identified, that's the time to take the action. You cannot delay it. You have to have an action plan right then and there. And we need to come up with the guidelines so that we are able to tackle it and get it done, get the kids back to the school in the best fashion. I wanted to relay this information here. It's a beautiful research. I wanted to communicate with all the parents who are, trying to raise best children, so that they become doctors, engineers, or really good businessmen, and whatever are the dreams of the parents. If you have more questions, please ask me in the comment section. Thank you for watching this video. Like, subscribe, and share. Have a great day. Bye.